You're live.
Great. All right, we're going to get started here in a minute. We'll give people a couple of minutes since we're right at the start time to come in. We're seeing the numbers go up, and we'll start in a minute. While we're waiting, I just would encourage everyone to put questions into the Q&A tab. We have plenty of time, I think, to answer questions. And the more you put in there, the more we'll be able to answer. All right. Well, why don't we go ahead and get started? We have a roster of providers that are on today. Myself with Transplant ID, Satish Nadig, who's the head of our transplant surgery program. Sejal Tana will be joining us shortly. Also, one of my colleagues in Transplant ID, John Friedwall with Transplant Nephrology. I believe Daniela and JC Caicedo will be joining shortly. Dan Ganger from Transplant Hepatology and Josh Levitsky is also on the call. Taylor Held Sargent from our pediatric Transplant ID group is here. And Shelley Sandana with the lead transplant coordinator is on the call as well. So what I thought I would do is just quickly run us through where we are in the pandemic, something that you all are probably acutely aware of. Unfortunately, with the Omicron wave, a huge portion of the world has pretty high rates of COVID-19, and while they're improving in some countries, they still remain at incredibly high levels. Globally, there are about 3.5 million people testing positive every single day, and about 8,500 people dying daily from COVID-19. Globally, there's about 360 million cases of COVID-19 since the beginning of the pandemic, and 5.6 million deaths due to COVID-19. Looking at our current status here in the United States, and this says the 19th, but I actually pulled the figure this morning. And as you can see, a huge portion of the United States is in the dark red and purple, meaning incredibly high rates of COVID-19. Thankfully, some areas, including the Northeast and even Chicago, are starting to see the numbers come down. Nonetheless, there are at least 652,000 new cases per day. That's a definite underestimate, since a lot of people are testing at home with home tests. There are currently about 155,000 people hospitalized in the United States and 2,362 patients dying every single day, so that we have a total of 870,000 individuals that have died in the United States, 8,007, not 70, deaths within the United States. Looking at the current situation, this is data that just came out of the CDC yesterday. You can see the number of emergency room visits and kind of the long dashed line, and cases of COVID-19 really are higher than they've ever been during the pandemic. And even admissions are in many parts of the country far higher than they have been in prior phases of the pandemic. With Omicron, the difference between vaccinated and unvaccinated individuals getting hospitalized in the United States is growing. Currently, if you're unvaccinated in the United States, you are 17 times more likely to get hospitalized than a vaccinated individual if you're 18 to 49 years of age. Similar if you're 50 to 65 years of age, and 12 times higher if you're greater than 65 years of age. And even among children, the rate of vaccination, the rate of admission is far higher in unvaccinated individuals. This is important because unvaccinated individuals not only are the patients that are getting admitted, but they're the ones that pose the greatest risk to anyone, because they can come home with an infection and spread it to others, including yourself. Looking at our data here in Illinois, we are starting to see a downtrend in cases here in the greater Chicagoland area. Unfortunately, the southern counties of Illinois still remain very heavily involved with COVID-19 and have much higher rates, and the southern counties, at least, are still seeing an increase in case burden. We're starting to see a downtrend in positivity rate here in Chicago, associated with a downtrend in the number of hospitalizations. Looking at our numbers here at Northwestern, as you can see in the red graph, which is this year compared to the prior waves during the pandemic, we had a huge number of patients admitted to the hospital. This strained the system pretty significantly. Thankfully, the numbers are coming down, but just to give you a sense, where we are today is at around where we were at the highest peak last winter. And so really, while things are improving, we still have a way to go before we're back into kind of normal functionality and normal burden of COVID patients in the hospital. Thankfully, the test positive rate, which peaked in Chicago around 24%, has come down nicely. We're starting to see it descend close to about 8% with the current data. Numbers here at Northwestern are lagging a little bit behind that, but clearly trending downward. What we've been focused on for the last 6 weeks or so is the Omicron variant. This has a number of mutations in the spike protein, particularly in what's called the receptor binding domain, and this is where most of our antibodies that we developed due to vaccine or prior infection are directed at, and this is why this virus is so diligent in being able to escape protection previously. This virus came up very quickly. This is data from sequencing from our group here in Chicago. I would focus on the graph to the left-hand side. Pink is Omicron, Delta is blue, and you can see right up around Christmas time, the majority of patients being diagnosed with COVID-19 were Omicron. That came up incredibly quickly. When Delta first came into the Chicagoland area, it took about 6 weeks from its first detection to being the major virus in the city, whereas this was literally about 2 weeks from introduction to peaking in the case in the city. There's been a lot of focus on how best to select optimal masks to keep us as protected as possible. Really, the key things is to make sure that you have a mask that's a professionally prepared mask, multiple layers. It covers your nose and mouth. It fits snugly around your face. It should really seal the entire circle around your face, and have a nose wire to prevent air from leaking at the top and to make sure that it doesn't slide down from your face. Many have been advocating, and the CDC has stated that the best masks for patients are either the N95s, the KN95s, the KF95s. The KN and KF95s are examples of which are shown here. Really, a lot of people are worried about making sure that they have a real or genuine mask. I think the biggest thing is the best approach is to go through a recognized purveyors, either large retailers. If you're going on Amazon, look for sites on Amazon such as 3M or Kimberly-Clark that are professional mask productions. If you're buying these from smaller purveyors, sometimes they're fake. Ways you can look out for that: N95s, there's a picture of which at the bottom, have to be stamped with the manufacturer's name on top of the term NIOSH, N-I-O-S-H. KN95s have to be stamped with the name of the manufacturer and a model that it lists GB2626-2019. If it doesn't have that, it may not be a genuine KN95 mask. KF95s have to say made in Korea on the device. And for people that are looking for good places to identify and buy these genuine masks, you can go to Project 95, the link of which is here, shopproject95.org. You can Google that, and they have not only a large list of genuine N95s, KN95s, and KF95s, but you can also click a link on that and be taken to a respected authority that will provide those masks. The CDC also has refined and clarified what they recommend in terms of vaccination. On the left-hand side is what is recommended for all patients that are not immunocompromised. And the reason why we're focusing on this is it's just as important to make sure you're up to date on your vaccine as a transplant patient as your family is to get all of the appropriate doses so that they're maximally protected. What we've learned with COVID-19 is getting that booster dose is essential to protect you. 2 doses of the Moderna or Pfizer vaccine really do not protect to the level that's needed against Omicron, and getting that booster dose is important. For healthy individuals, they should get either the Pfizer or Moderna vaccine, the standard 2-dose vaccine about a month apart. They should get a booster dose 5 months after their second dose of Moderna or Pfizer. This is a slight change from 6 months to 5 months that was made over the holidays. This booster dose is authorized for any individual that is eligible for vaccination. For patients that got the Johnson & Johnson, they should get a single dose of Johnson & Johnson, followed by a second dose 2 months or more after that. That can be either a J&J vaccine or one of the mRNA vaccine. They have clarified that someone is considered up to date only if they've gotten their booster dose. So again, make sure your family members are up to date to help protect you. As transplant patients, if you've gotten the Pfizer and Moderna, you should get 3 doses, each about 1 month apart, and then a additional booster shot 5 months after your first 3 shots of the vaccine. If you got the Johnson & Johnson, you're eligible for a booster shot 2 months after the first dose. Now, we'll talk about this in the Q&A as well, but I know many of you may have been going to commercial pharmacies to try to get this 4th dose and may have been turned away. There was a meeting today between CDC, Walgreens, CVS, and other large pharmacies where they were making commitments to make sure that they will honor this booster dose. And so hopefully moving forward, those of you that have been frustrated trying to get those doses should be able to get them at commercial pharmacies. It's really important to recognize that booster dose does provide significant protection against infection and death. You can see the data from CDC. The solid line on the top are unvaccinated individuals. The dashed line are patients without booster. The kind of bigger dashed lines are patients with a booster. So clearly you have a much greater protection against getting infected and from dying if you've gotten that booster dose. It's also important for us to recognize that we need more than vaccines and masks to keep us all protected. It's really important that you get your booster and stay up to date with your vaccine, that you wear a mask anytime you're in an indoor shared space, but that you add other layers of protection. If you've been exposed or if you become sick with COVID-19, it's important to quarantine or isolate based on guidance from the CDC. You should use appropriate testing, which includes those home PCR tests, which you can order yourself on the COVID test website by the US government. You should optimize ventilation. Now that it's as cold as it is today, you're going to have to rely on air conditioning and filters in your home to facilitate that. If you're in a crowded space, you want to limit your time there. Make sure that you're wearing your mask, focused on hand hygiene, and really try to keep that distance from others. Moving on to our available therapies, things have changed since the last time we updated you. We have discontinued the use of two of the antibodies that we were using for treatment up until Christmas time, the REGEN-COV and the BAM-EDI combinations, and now are only using the sotrovimab monoclonal antibody. Initially, there was significant shortages of the sotrovimab. While we still have far fewer doses than we would like, the availability of this has stabilized. Giving sotrovimab, this monoclonal antibody, to patients that are sick with COVID-19 results in about an 80% reduction in the need for hospitalization. And so this still remains our mainstay of treatment for patients that are transplant recipients that test positive for COVID-19. So if, God forbid, you get sick, it's really important to call the transplant team immediately so we can get you in to get a dose of sotrovimab if it's available. The benefit of this is greatest the earlier you start after you test positive. So you don't want to wait and see if you start getting sick. You want to get that therapy delivered as soon as possible after infection. So call the team to get that done. We'll be talking a little bit about a new monoclonal antibody, Eversheld. This is a therapy that can be given prior to getting sick with COVID-19 to hopefully prevent the infection in the first place. We know that our transplant patients have reduced response to the vaccine, and this should help bolster their protection. There is a very limited supply of this drug. In the United States, there are about 5 to 8 million immunocompromised patients with an inadequate response to the vaccine who are eligible for Eversheld. Here at Northwestern, we have prioritized a group of patients that have gotten rituximab and similar medications around the time that they've gotten the vaccine to be the first to get these doses. The reason for that is that patients that receive this therapy are generally advised not to receive a vaccine within 6 months of the receipt of this monoclonal antibody, and their response rates are incredibly poor if they do get it before that time period. To put things into perspective, in our first allocation, Northwestern got about 90 doses of Eversheld. And there are 100 eligible patients for each of these doses at Northwestern, just limited to the immunocompromised patient population. As a result, the allocation is currently being done as a lottery, and so you don't need to do anything to get on that allocation lottery. Calling in will not increase your chances of getting the drug. You will be called by the transplant team when the doses are available. Currently, only people that have gotten rituximab or similar drugs are part of the allocation, and we will eventually start allocating to the broader range of transplant patients once we get through this group. We expect it'll take a month or more to get through that initial group of patients. There are 2 new pills that are available. The first is called molnupiravir. We oftentimes won't be using this in our transplant patients because it helps reduce the risk of hospitalization, but only by about 30%. And so monoclonal antibodies would be a better option for our transplant patients. But for many non-transplant patients, this may be a therapy that your doctor may order for you. It's much more available than the second drug, Paxlovid, that we'll talk about in a second. It is relatively safe and does not interact with most medications. It cannot be used in people that are pregnant or are planning to get pregnant in the near future. The second drug, which you've probably heard a lot about, is Paxlovid. This is a pill that you take for 5 days. It affects the way that the virus is able to replicate by blocking a key protein. Unfortunately, it has significant drug-drug interactions, and most transplant patients should not receive this. In fact, if a provider recommends this to you, please call the transplant team before even picking up that prescription, because that may not be appropriate for you. Unfortunately, the Paxlovid is available in very limited quantities throughout the state of Illinois. Throughout the entire state, there's only about 3,000 courses of this therapy. It's also sometimes challenging to find the drug. There is a website run by the U.S. government called healthdata.gov. If you Google COVID-19 public therapeutic locator, you can find the sites in Illinois that have the drug of interest. It also provides updated information on the number of doses that site has. That is only updated once per day, and so it's possible that they had doses in the morning, but they're out. We have built a system within Northwestern to help our providers find these therapies very quickly. But to give you a sense, there are only 6 pharmacies within the city of Chicago that have Paxlovid, slightly more in the suburbs, but again, very a small number of pharmacies, none of which are in the downtown core. So finding this will take a little bit of sleuthing, and the providers will help you access this if that's something that's appropriate for you. But again, if someone is recommending or starting you on any of these pill therapies for COVID-19, please call the transplant team before picking that medication up so that we can tell you whether or not that would be appropriate for you. So it's important to remember we're still seeing flu cases out there. So while everyone's been focused on COVID-19 vaccine, if you haven't gotten your flu shot, please do so. Boosters for COVID-19 are incredibly important, especially in the setting of Omicron. Get yours and your families now. Don't wait for the Omicron variant booster. This is when the cases are very high, and this is the time that you need them. Everyone that's eligible for a vaccine is eligible for a booster, and get that booster right away. Don't let your guard down. I think this is going to be incredibly important. People are already starting to talk again about how the COVID pandemic is starting to end. Everyone's excited because the cases are going down, but there's still an incredibly high amount of new patients testing positive and significant disease in the community. Omicron is far more transmissible, particularly in indoor settings, and places that have been high risk for people since the get-go of the pandemic, including restaurants and bars and other areas where you're going to be unmasked for more than 15 minutes, are even higher risk now in the setting of Omicron. And again, you as a transplant patient that's more susceptible to infection potentially and at risk for severe disease really needs to be cautious with these locations. Things will get better when the numbers get much lower. These types of locations will be safer for everyone, particularly if you're vaccinated. Most importantly, if you're sick, call your doctor as soon as possible. If you have access to your home test and it's positive, you have COVID-19, you should still call the transplant team to get the treatment, but you likely won't need any further diagnostics at that time. If you don't have access to the the diagnostics at home, again, call the team. We can arrange for that. And if you're positive, arrange for the appropriate treatment. So with that, I'm going to close out the slides and start turning things over to some of our panelists here to do questions. So this one first, I think we'll send to you, John. I will be eligible for a 4th shot in February, on February 28th. My first 3 shots have been Moderna. Should I get Moderna or Pfizer?
Thanks, Dr. Eisen, and I just want to say hi to everybody and thanks for being here again. So yeah, I think right now the recommendation is to stick with the mRNA vaccine that you've had. The 4th Moderna shot would be the booster half dose. It is okay to switch over to Pfizer if that's all you can find, depending on where you go. The key is getting it and getting it as quickly as you can. Putting it off only increases your risk of getting infected in the meantime because there's a lot of spread out there. So I think Dr. Eisen's points about, no time like the present, go out and get your booster if you need it and get it done. I think one of the things that we probably need to address, and I'll maybe ask other people to chime in, is there are a lot of questions about, I'm almost due for my 4th dose. Should I wait if Evushield's going to be coming? Should I go ahead and get my 4th shot? Maybe Dr. Eisen, I'll throw that right back to you. What do we do about, number one, timing of the 4th dose with Evusheld? And if you can get Evusheld today and the 4th dose, should you just get the Evusheld, or get them both, or what should people do about that?
Yeah, so I think that's an important question, and the number one thing we should be doing is getting your vaccine. That's the booster shot or the 4th dose for you and your family member. The number of transplant patients that are going to be eligible for Evusheld in the next a month or so is a small fraction of the overall transplant population. So I would definitely get the booster shot when it's needed. If you get the vaccine, you can still get the Evusheld. You just have to wait 2 weeks after the vaccine, and really, that is a very short period of time to wait. If you get the Evusheld, currently we're recommending not to get the vaccine after that dose is given for 90 days. That guidance may change in the near future. And we'll update that when you come in for the Evusheld. I think the biggest thing, and Dr. Friedwald really pointed this out, that getting the vaccine now, if it's due, is the important thing. There's a lot of disease out there, so we need to get that boosted.
Yeah, and I think a lot of people are coming up for it now because a lot of people did get their booster in the sort of early fall period. I've definitely seen a lot of people get their booster in August, September, and October. So it's coming up around 5 months. So it's something that it's time to start doing. And we wish we had a better prediction. There are a lot of good questions about when am I going to get my Evusheld? When is it going to be available? And I wish we had better answers for that. But as it rolls out, the supply is coming. We should have a lot more in the next few months, but right now it is fairly limited. So if you have an opportunity to get your 4th dose, go ahead and get it.
So there's a question, and I'll let Dr. Nadig answer this. When can I start thinking about elective surgeries as a transplant patient?
Yeah, it's a good question. Again, I want to reiterate Dr. Friedwald's welcome to everybody. Thank you for joining us. It really actually depends on the surgery. We really would like for you to be at least 6 weeks out from surgery, or from your diagnosis, just to make sure that you're very much asymptomatic and okay. But you have to be absolutely asymptomatic. One of the issues is that your COVID test could be positive for months, and so it goes beyond just a quarantine date. But we just want to make sure you're asymptomatic and you're well beyond your time for quarantine. So I would say 4 to 6 weeks, and then we can start discussing planning your elective operations.
So the next question I'll send to you, Taylor. So my dad tested positive for COVID a couple of weeks ago. I'm assuming he's the transplant recipient. When can he go for his 4th dose?
So he can go and get his shot as soon as he's out of quarantine, and assuming that he didn't have a severe infection, it should be when his symptoms are resolved. But if he landed in the hospital or needed extra care, then reach out to your doctor to find out exactly when he should go and get that dose.
Perfect. So this one will go to Shelley. Can NM send medication to a patient who is traveling and test positive? What about if they're in Cancun?
Like the Evusheld or Sotrovimab? Is that what
I think they're just, I'm not sure if they're asking about that or their transplant meds.
Oh, okay. Well, if that happens, definitely give us a call. We can send a prescription. A loved one can pick it up and mail it over to Cancun if needed. Or, you can try and see if there's a pharmacy that actually dispenses any of your transplant medications, and we can give them a call as well.
This one's a good question for you, Shelley, as well. What number do I call for the transplant if I Dr. Friedwald just entered it, but for patients that if they're sick.
Yeah, the number to give us a call is our regular clinic number. So it's the same number to speak with the nurse or reschedule an appointment. We keep it easy. It's 312-695-8900, and then you follow the prompts to post-transplant to speak with one of our nurses.
Perfect. So this I'll send to you, Josh. This is a liver and kidney transplant recipient, vaccinated and received booster in September, tested positive for COVID at the end of December, was planning to receive his second booster dose in early February, which is 5 months from his last booster. What should he do?
Yeah, I think Taylor mentioned a similar situation, right? A recent COVID, and I think you can wait till recovery and go get the booster. I don't think there's 2-3 weeks after the infection. I think that's okay, right, Mike?
Well, as long as you cleared the quarantine.
Clear the quarantine, yeah. So kind of the same situation that Taylor mentioned.
So this is a good one for you, Dr. Ganger. How do you know who's a healthy individual versus a solid organ transplant to know who should get just 3 doses versus the 4th dose?
Well, I can speak for myself because I consider myself immunosuppressed. So I immediately after my 5 months from the booster, I took my dose, and at this point, I think that healthy and vaccinated obviously helps you for the severe disease, but I would not skip the booster because you can help stop transmission in some way or lower the transmission. So I as soon as you can get it and you're qualified, get it. Healthy or post-transplant.
Perfect. So this will be a question for Taylor. So we as transplant patients continue to act like we are unvaccinated. Does this mean that I'm 17 times more likely to contract a COVID-19 as a vaccinated transplant patient compared to so equivalent to being unvaccinated?
So we ask that you continue to take precautions and act like you're unvaccinated just to be as safe as possible. The reality is there's a whole spectrum and it's impossible to predict really how much each individual will respond to the vaccination. So it's possible that you completely responded and you are completely protected, but we don't know for sure. And that's why we just want you to be as safe as possible and act like it. But no, I don't think you're 17 times more likely. We just can't give you an exact number.
Yeah, I totally would agree with that. I think, there's definitely a significant reduction. The data from the UK clearly shows, a significant reduction in the risk of disease, but more importantly, the risk of severe disease, even in the immunocompromised patients. There is still a risk in transplant patients, and we don't have good markers to know which patients, as you said, are the greatest risk versus those that are not. So this will be a question for Dr. Friedwald. I'm getting mixed messages regarding the 4th shot. When I messaged my team about a month ago, I was told that NM had no recommendations yet, but now I'm hearing that they should get a 4th dose. I had my 3rd dose in mid-August. What should I do?
Yeah, thanks. And, I will say that all of the evidence is accumulating and the recommendations are evolving. And so we are trying to evolve with the recommendations. And so we appreciate patience. We also understand that it's confusing. And so that's why we're having this. So yes, if you are now 5 months from your 3rd dose, it is recommended by us and by the CDC to get a 4th dose, which would be considered a booster. That could either be, assuming you had 3 doses, you probably had one of the mRNA vaccines, either Pfizer or Moderna. The fourth dose could be another dose of either one of those, depending on what you can find at a pharmacy or wherever you get it. I will say that we do now have limited amount of Pfizer vaccine in our clinic for people that are in our clinic. If you need a dose, we will offer it to you. But oftentimes the easiest place still to get vaccinated is just a local pharmacy. So to reiterate, yes, if you have had 3 doses of mRNA vaccine and you're 5 months out from your 3rd dose, we are recommending a 4th dose of vaccine.
Just to touch base on what Dr. Friedwald was talking about, the ever-evolving process, and just the fact that we all appreciate your patience with us as well as with the environment. They're changing, really. People aren't using the terminology fully vaccinated right now anymore. They're using up to date on your vaccines, and so that just gives you an idea of it's just ever evolving for the entire process.
And I've got a question, so it's a good thing you're on camera, Dr. Nadig. So this is a patient that's a healthy kidney donor. Their question is, should they be counted as a healthy adult getting 3 doses or as an immunocompromised person eligible for 4 doses?
Well, all else being equal, they're a healthy individual that's not immunocompromised. They're not on immunosuppression. Now, I don't know what other comorbidities or other disease processes this particular individual has, but all else being equal, they would be considered a healthy individual that is not immunocompromised.
I had, so this is a patient that I had all 3 shots and still ended up hospitalized with COVID-19. When should I get my next booster shot? Dr. Lewitsky?
Yeah, I think it's, you know, depending on the hospitalization. The idea here is you recover from the infection, get home, you know, make sure it probably a couple weeks you can go ahead and get, you know, the booster. I think an important thing is if you get COVID infection, it doesn't mean you shouldn't go get your booster vaccinations. That comes up sometimes. People think, oh, I've got the infection, I got Omicron, I've got antibodies. You can get it again, and there'll be other variants. So just even if you get COVID infection, just go get your boosters, and you can just, you know, again, post-hospitalization or post-infection, give it a couple weeks, and if it's the timing for your booster, go get your booster.
Yeah, I think the only caveats to add to that is if you got one of the monoclonal antibodies, you have to wait 90 days after getting that. And then we just want to make sure you've cleared your quarantine to make sure that you don't infect anyone else. So this will go to
Mike, can I ask just a clarification? So that's also sotrovimab too, so you have to wait, right? So many of you will get that to try to prevent the hospitalization, but that it sounds like it should cover you for a few months till you get your booster, right?
Yep.
And then you have to wait 90 days, and then you can get the booster after the 90 days.
Yep.
Yeah.
So this will be for Dr. Friedwald. Neurologics and boosters. What should we do?
Yeah. So we're still recommending vaccinations, full vaccination series, and being up to date, which would include a booster. So again, the CDC terminology is now up to date, and so for anyone who is more than 3 months out from their 3rd dose, a 4th dose is recommended as a booster. Now, that's the baseline. What we know is that being on Neurologics or belatacept can reduce your chance of forming antibodies, which is the whole idea of a vaccine. And that's one of the reasons that we are prioritizing people on Neurologics or belatacept for Evusheld. So in the top tier are people who are also on Neurologics, and for the reason being that they're less likely. It doesn't mean they have no response to the vaccine, but less likely to form high levels of antibodies to the vaccine. And I think we've talked about this before, but the vaccine can protect you in several ways. One is forming antibodies, but we also have what are called T cells, which are part of our immune system, and they can also keep you from getting sick if you get the virus. So there is still some protection, we think, but probably not as much protection, which is why people on belatacept, Neurologic, are being prioritized for the Evusheld doses once we get them.
Perfect. So this is going to go to Taylor, and you sort of answered this with your last one, but are there tests that are available to identify if a individual is at higher or lower risk of getting very sick? How can I know when I can stop being as safe as possible?
Well, I'm glad we just got this little primer on antibodies versus T cells, because one of the tests that people try to use to see, did I respond to the vaccine, am I protected, is to get this antibody test. But the antibodies, as was just mentioned, only show part of it. So we don't recommend routine testing for antibodies after vaccination because, one, it doesn't tell the whole story, and two, you might have some protection from your T cells but be antibody negative. So, right, and then there's also this whole factor of some antibody tests don't test for the same antibodies that the vaccine makes. So the vaccine makes antibodies against that spike protein that Dr. Eisen was mentioning earlier in the presentation. And some of the antibody tests test for a different protein, an N protein. So we don't right now recommend using that antibody test to see if you're protected because it doesn't give a complete picture and might actually give the wrong picture.
So the next question I'm going to send to you, Shelley. So I got my the vaccines, but I'm going to be out of town for 2 months. If I get sick with COVID, do I still call you or do something else?
Yes, you should definitely give our office a call back, even though you are out of town and do get sick with COVID. We do have a national phone number where that can refer you to, a local infusion center that may have sotrovimab for you. So yes, definitely give our office a call.
Perfect. And this will be for Dr. Ganger. Do you recommend a fourth vaccine for members of the recipient's immediate family, even if they're otherwise healthy?
Yes, yes, yes.
Yeah, I'm not sure I totally agree with that. I think the third dose is all that's authorized by the
I know, but
CDC. So you probably will have a hard time getting that.
I know, but I don't know what the Danish thing is coming up. In the unknown, I like to stay safe, but you are the expert. But I am so pro being protected and protect my loved one who is immunosuppressed.
I think the bigger thing is just making sure if your family isn't fully vaccinated, particularly if there's little kids around the house,
oh, sure.
Making sure they're fully vaccinated. And then kind of along those lines, Taylor, I'm surprised I haven't seen the question come in, but what do you do if you've got a 4-year-old around the house and you're a transplant patient? What's the best approach with sending them to daycare? What if they get sniffles?
Well, you try to get as much rest as possible because 4-year-olds are a lot of work, as I know, but you just try to do your best. They do have masks out there that are KN95s and KF95s for little children. There's some good brands. If you look online and look on those resources that Dr. Eisen mentioned, you can find ones that are high quality and actually fit the young children. Also be in communication with schools to make sure that they're following all the mitigation practices that they can. And this goes for older children too, trying to make sure that they've improved their air quality, that they're consistently masking, that they have a contact tracing and hopefully testing policy in place. And really just try to do everything you can to protect your child from bringing it home. I will mention that there's also been some chatter recently in the social media realms about a push to try to reduce masks and some data that's been reanalyzed. And I'd have to say that if you come across this or if you notice that anyone is pushing for taking off masks in schools, we don't recommend that at this time. We still wholeheartedly support masking in schools. We find that, like Dr. Eisen said, that's one of many layers that's important in addition to vaccinations. And I implore you to follow the guidance on the CDC website and look to the data there for the most up-to-date information.
So a pretty straightforward question. I'll send it to you, Dr. Levitsky. If you are only taking tacrolimus and not mycophenolate, are you still considered immunocompromised? You're on mute.
Sorry about that. Yes, absolutely. I mean, any T cell inhibition or B cell inhibition therapy, tacrolimus, mycophenolate, cyclosporin, prednisone, and some of the drugs that Dr. Friedewald mentioned, Nulogix, rituximab, Imuran. Even if you're taking a day, one pill a day or something, you're considered immune compromised. There are different levels of it, absolutely, and that's why the Evusheld is being prioritized for those who are most immune suppressed, these antibody therapies. But you're still immune suppressed, and also we don't know if you're truly differently immunosuppressed if you're on one drug versus 2 or 3. But regardless, you're considered immune suppressed. So then get your 4th booster when you can. Take all the necessary precautions that we've been talking about. Kind of consider yourself unvaccinated, and use the precautions, around other people, inside, etc. But yeah, absolutely.
So another question for you, Dr. Friedewald. So I'm scheduled to get my next dose of Velatacet next week, and I'm due around the same time for my COVID shot. What should I do?
Yeah. So we are recommending go ahead and get the shot. There is not clear guidance about should you wait or not. If you're at a period where you're getting Velatacet every 4 weeks, a lot of people are at that point where they get monthly. You may wait a little later in the month before you get your next dose to get your shot. So we're saying somewhere about halfway in between the 2 doses to get the booster. So you might want to do that, but otherwise we'd say go ahead and get it. Now the question I think also came up, well, when am I going to do, when's Evusheld going to be available? And we don't exactly know. If you've had your 4th dose, as long as you wait 2 weeks after that, you can get the Evusheld. So I would say go ahead and get the 4th dose, and then whenever shit's available, if it happens to be less than 14 days after you had the vaccine, we have to wait a little bit, but I don't think that's, it's still going to be a little while, as Dr. Eisen mentioned before, the Evusheld is really widely available. And I'll also say, the questions come up about, if you're not immune suppressed, should you get the 4th dose? Currently, the CDC is not recommending that. That may change. And so I think, again, this has all been evolving and we're learning a lot as we go along, and we're building the plane as we fly it, as we like to say. And so, the recommendations may change. It's not that the recommendation now is wrong, but we're waiting on updated evidence and guidance for non-immunosuppressed people of whether a 4th dose would help. And I know Dr. Ganger is just trying to do his best to protect everybody, but there's not a difference between what we're saying. It's just that currently the CDC is not recommending that, and we're trying to follow the best evidence and CDC guidance.
So the next question I'm going to send to you, Taylor. Our adult son is not vaccinated, and he doesn't plan to be. He had COVID for 3 weeks in September. Can we assume he's protected and is safe to be around?
Unfortunately, we found that you can get COVID more than one time, especially in this latest Omicron variant. Reinfection is common, so you cannot assume that he's protected, and continue to really implore him to get his vaccine.
Gotcha. And then this one I'll send to you as well. How much better are the N95 or KN95s compared to surgical masks, and are there a big difference between the two, KN95s and N95s?
You wanted me again?
Yep.
Okay, so the surgical masks, although they work very well. If you've ever worn them, you'll notice that there's a big gap on the side that air can go in and out. So although they do have protection in the front, it's not all around. N95s, KN95s, they really form a better seal. So they are much better when they're done, when they are able to be worn properly.
Perfect. So this I'll send to you, Dr. Nedig. when are we going to know that it's safe as transplant patients to go back to normal?
Yeah, I wish that that the answer was right now. You know, honestly, we have to get to a level of positive testing to much lower than we are right now. You know, less than 5%. It's got to be where. And it's a concerted effort with all of us. We all get up to date on our vaccines. We all wear our masks, and we make a concerted effort to stop the spread of this virus. And when we do that, and it's less than 5% have tested positive, then we can start to have discussions about going back to quote unquote normal. There's going to be a new normal for a little while still.
So a question just popped up that I'll answer very quickly. If you received a transplant at NU, are you definitely automatically on the list for Evusheld? The way that the system is working is if you get your care at Northwestern, if you got your transplant here, you're in the system, and the allocations will go from there. As long as we have your current phone number, you will receive the call. If you have my chart, they will be contacting you that way as well. So be on the lookout. Pick up the phone if the transplant center calls, but everyone that's a transplant recipient will be on the list when we go through there. What's the best type of mask that patients should be using at this point, Dr. Lewitsky?
Well, I know that the surgical masks, the ones that you see everybody wearing, are quite good. Certainly, you know, N95s, KN95s are probably the most level of protection. The ones that I know, Mike, you'll have those. They'll be able to look at those slides again. But if there's certain ones that are not very good at protecting, like the vinyl ones, the ones that have the side things that can allow the virus to actually get in. So, you know, I think, I don't know, Mike, if you want to put up that slide or they can go back to it, would be a good, you know, thing to look at to answer this question.
Sure. I'll try to pull that up.
Yeah.
Hold on, it'll take me a second. We'll definitely share that out. I think I closed the slide, so I will get it up there in a second. The next question, and I'll send this to Shelley. I tested positive on December 28th. I had no symptoms. It was a pre-procedural test. I then developed symptoms, including a runny nose, cough, and shortness of breath. I'm still having a lot of those symptoms. I know that every case and person is different. How long can I expect to stay positive for COVID-19?
It varies. We are seeing a lot of patients just for a couple days, and then there are some patients that have symptoms for 40 days. So I think as long as you're feeling well, you go a couple days without symptoms, definitely get retested. We do consider you cleared if you do get COVID tests more than 24 hours apart. But we do recommend getting retested after a couple of days you don't have symptoms.
Yeah, and it definitely, I think, as you pointed out, is variable. Our transplant patients are generally do stay positive a lot longer than otherwise healthy people. And I think it's important to point out that, you know, the change in guidance down to quarantining of 5 days or until you test negative has not changed for our transplant patients. They still need to test negative to be clear from quarantine. So I think this is the flip side of the question. I'll send this to you, Dr. Nedig. How safe is the hospital? If I have an elective procedure, should I feel safe coming to the hospital for that procedure?
The hospital is a very safe place, frankly. Everybody's vaccinated, almost everybody's vaccinated, if not everybody's vaccinated. Everybody's masking, PPE. A lot of precautions are being taken. So in many ways, the hospital can be a safer place than other outside extra hospital environments, if you will.
I would like to mention, some of you may have, because our GI lab at Northwestern has taken the stance of, really kind of elective screening colonoscopies. We're delaying those just, to accommodate other patients and reduce patients coming in for really things that can actually wait until the Omicron virus starts to, really come down. So if any of you have been put on delay because of that, don't worry, the lab will reach out to you to get those done, but it's just an example. I mean, I would say if it's something really elective, then it's safe to come, but you may want to delay it if it's not needed to be done anytime soon. That would be my feeling.
Perfect. So we're getting close to the hour. I'm going to kind of do a round robin to each of us, one take-home message that you want to remind the patients. And since you talked last, we'll start with you, Dr. Levitsky.
Get your 4th booster. Really important.
Dr. Ganger?
Don't let your guard down with a mask, in spite of the popular people on TV saying it's over or get over it. I'm not convinced of that. It's a pandemic, it's unique. Just keep the guard up.
Yep. Satish?
Keep your spirits up. There's a second pandemic of despair that goes through all this, and we're really sensitive to that. So do whatever you can to keep your spirits up. Everything will get better. We just have to make sure that we're supporting each other.
Shelley?
Tell the clinic if you're positive. And yeah, keep your guard up, and then be patient. Evusheld will come, but just be patient. We'll get to everyone.
Taylor?
So many good ones have been taken, but I'd say remember that you do have an important voice. Be an advocate in your community and your family. Make sure that you're continuing to remind everyone that although we are tired and we all need support, that there is still people out there that are facing much risk, and we need to continue on as a community together.
John?
Yeah, again, I want to thank everyone for being here. One quick question that came up, and we could maybe address it. Evusheld is currently not being charged to insurance, right? It's free. Okay, so someone said they were going to check with their insurance and they can do that, but I don't think it's being billed to patients directly right now. Is that correct, Dr. Eisen?
The drug is free, the infusion is not,
Okay,
but that would be covered by your insurance.
Okay, good distinction. Thank you. What I'll tell everybody is, one of the things we've learned after living with this pandemic, unfortunately, for as long as we have now, is we know the ground rules. We know how COVID spreads. It spreads through the air. And that's why well-ventilated spaces outdoors are much safer than tight indoor spaces. And so if you know where the risk is, being indoors without a mask on around other people without a mask, that's where it really spreads. Someone mentioned the food court on the second floor, everyone's got their mask off eating. That's a dangerous place, even in a hospital. And so if you know where to avoid, particularly for those of you who are at higher risk because you're not as protected by vaccines, you can still get out and do things and live a life. Going shopping at the store with a good mask on is a safe thing to do. Going to a dinner with 20 people in a tight room with no windows open is not a safe thing to do. And so I think, we can now do certain things that are low risk and get back to what we like to do and avoid places are high risk. Indoor restaurants, indoor settings currently are very risky. And that's why we see it in the South in the summertime because everyone's in the air conditioning. In the wintertime, everyone's in the heat. And so indoors is where this spreads. Outdoors, it's much safer. And so learn the ground rules and learn where you can do low risk activities and get back to doing things you enjoy, because we all are tired of doing this, but we need to keep our guard up and do it smartly.
Great. Well, I want to thank everyone. My kind of parting comment is, as we've seen, every time we think we've figured everything out, a new curveball is sent our way. I think all of us expected to see an increase in cases in the winter. I don't think any of us saw Omicron and what the impact would be. There's been guidance that have come out and changes to that, change to when the fourth dose was recommended over the holidays. That will continue to happen. We will be continuing to host these webinars to help you understand as information changes, and appreciate your patience with us as some of our recommendations change with guidance from the experts and the knowledge. With that, please get your booster, please wear your mask, please stay safe. And soon enough, the case numbers will be improved and we'll be able to do more things that we would otherwise like to do. And more importantly, stay warm because it's freezing outside. Have a wonderful night.
Night, everybody.
Good night, everybody.